Dr. Robert Young from Doctors for Responsible Gun Ownership is here to help us answer the question, is gun violence really a public health issue?
But first, self-defense and emergencies can happen to anyone, and there's no guarantee that the justice system will be on your side. Gun owners should have coverage for the legal battle after your self-defense battle. And while you protect your family and property, U.S. Law Shield is here to defend you 24/7, 365 days a year with comprehensive self-defense coverage at an affordable price. Bad guys don't take days off, and neither does our coverage. And guess what, Gun Owner Radio listeners? You can get a free T-shirt when you join. Use promo code GunOwnersRadio at uslawshield.com. So our special guest is Dr. Robert Young. Are you there, sir?
I am. Happy to be with you.
Great to have you. So you're with Doctors for Responsible Gun Ownership.
Yes.
That sounds really interesting. Why don't you tell us a little bit about yourself and the organization and introduce us to what you do?
Happy to do that. The Doctors for Responsible Gun Ownership was founded in 1994 by a Southern Californian surgeon named Timothy Wheeler, who actually retired from it finally 2-3 years ago. He was reacting to the considerable antipathy expressed by organized medicine, first in his own California Medical Society, and up to and including the AMA, the National Pediatrics Organization, and the CDC. We have quotes from all leaders of all these things documenting their hatred of guns. They're wanting to see them all banned. They're considering them with no redeeming social value, just terribly prejudiced stuff. So Dr. Wheeler, along with some other good researchers and experts on the subject, testified before Congress to describe all this. And the result of that was the Dickey Amendment of 95 or 96, which banned the CDC from using any money to advocate gun control. It's never banned doing research, which is the false accusation of the left and has always been. So that's why and how DRGO developed. And what we are is a national organization of anybody who wants to be part of us, certainly largely focused on representing the great mass of physicians who disagree with their professional groups' leaderships on guns. And probably more physicians agree with us, I would guess, than with the profession's continued enmity towards guns and advocacy of considering it a public health crisis and needing public health researchers to tell us how we can eliminate, quote, gun violence, unquote, which isn't a real term anyway. The gun control lobby has made up a lot of terms, like assault rifle, gun violence epidemic, things like that actually, when you look at it, don't mean anything.
Yeah, absolutely.
Now, so we're in a position as physicians to evaluate a lot of this research that comes out from the medical researchers, quote, public health researchers. And most of it is shoddy to highly biased. And we are people who are very willing to point that out.
Awesome.
We've done that. We do that in interviews. We do that in writing on our website. I and we have written for lots of other national media, spoken with them, of course. We've testified at various legislatures. We've contributed to amicus curiae briefs for many of the major, all of the major gun cases that have come to the Supreme Court in the last 20 years. And we're all volunteers. Most of us are still very busy in our practices. So that's in a nutshell. That's who we are and what we do. I happen to be a psychiatrist in the Rochester, New York area, I'm been around for a while, so I am currently an associate clinical professor at the University of Rochester School of Medicine. I'm a distinguished life fellow of the American Psychiatric Association, which is for service to the profession. I'm in active practice with a private practice a couple of days a week, and I'm a medical director for a very busy substance abuse treatment facility in downtown Rochester. And I do this because for two reasons. I do DRGO for two reasons. I am the executive editor, so anything you see on our Facebook, which we update several times a day, anything you see on our website, we try to publish 2 articles a week, has come through me, and I'm responsible for how it comes out. I was drawn to this for 2 reasons. Some of my ancillary work had kind of died down, and I was thinking during the last part of my career, what can I do that could be of maybe some national significance? And obviously, you can't just insert yourself into national prominence on any subject you're thinking about. But I also at the same time, I got interested in the gun question because in just reading about it, I realized I never read anything about the benefits. When you're evaluating interventions for public health, you balance risks versus benefits. Anything in medicine you're considering as an intervention, you balance risks versus benefits. And all I ever read about were the risks, and that made absolutely no sense. So I started reading about it more, and I realized there are huge benefits. In fact, they outweigh the risks and the negatives about civilian gun ownership. So I put those 2 things together, and I got to know Tim Wheeler remotely. And this is a great place for me to work because we do have effects nationally on this vital civil rights issue of our time. And I'm really proud to be able to contribute to that.
So Dr. Young, what just a question, the advantage, I guess, to calling to attacking guns as a public health issue, because it's certainly not a new thing. I mean, they were doing it back in the 90s at least.
That's right.
And they do a lot of that now, not only with guns, but they'll throw racism out there as now a public health issue or a crisis. And everything is, and strategy-wise, what's the advantage to that side for doing that? Why is that approach popular, I guess, nowadays?
Well, the more acute you can make something sound, the more people get upset about it. The more people get upset about it, the more they want somebody to fix it. And the more they want somebody to fix it, they will listen to whoever sounds like an expert about the solutions. The gun control industry, that's the phrase I'm using lately because it really is. These people make their livings doing research and holding seminars and conferences about how and why we need to reduce the number of guns in this country. It is an industry, and they need to sustain themselves. They do what they do. They want to keep doing it. They can only do that with money. They get plenty of money. Funding's been out there forever from the Bloombergs and the Soros foundations and other left-leaning sources. But there's actually been no lack of research ever. In fact, there's more and more research there's more and more research, period. This is an example of how they misconstrue things purposely. Research on gun violence, supposedly as a public health issue, has declined as a percentage of medical research. And I say, why would you not expect that? The field of medicine is constantly growing. What we've learned in genetics and pharmacology, drugs, more and more are coming out. The whole profession is getting wider and broader and deeper. Why would any one subject not gradually take up a smaller percentage of attention, even though the absolute number of papers published on, quote, gun violence by public health people has expanded. Thankfully, there are more and more good studies by people like criminologists and economists that really tell the truth. So we pay attention to those, too.
Well, wasn't that one of the issues with one of the original bad studies, I guess, about about gun firearms related, I guess, murders and shootings and things like that, is that it doesn't behave like a virus. It's a different thing.
No,
so using a medical approach to study that gives you bad results as opposed to coming at it like Dr. Lott from an economist's point of view or something like that.
That's absolutely true. And John Lott, who I know and very, very proud to know him, is one of the most important figures in gun research. And he tells it like it is. Economists look at the numbers, and they are very good at evaluating issues by numbers. The other people who count are criminologists. They look at homicides with guns, without guns, and they look for these are all criminal acts, period. These are not, as you point out, these are not virally induced. So criminologists are the ones with the best handle on that. Now, the biggest proportion of deaths by shooting are, of course, suicides, and that's about half of all the suicides. So it's really a really important thing. But that you have to look at from a mental health perspective. There's no other way to consider it. And to stop someone committing suicide is impossible at the point that they decide to do it.
Well, see, and that's another point of misinformation that you see out there, too, because I believe they say the suicide rate is roughly, about 30,000 a year that are related to firearms.
No.
And, again, it has nothing to do with firearms. If we look at Japan, for instance, who's consistently near the top of the list for number of suicides there, and nobody owns a gun in Japan. But yet the left, it just goes that way.
That's right, and that's one of the comparison to Japan is very important. A lot of people point out validly that if you can stop someone from committing suicide with a firearm, they have a good chance of never dying by suicide. And if you don't, they have a real good chance, 90% chance of dying by that one shot. It's quite a lethal method to choose. But the trick is how to intervene with just those people at just the right time.
Hey, Blackhound Optics, accurate, affordable, guaranteed, sporting optics that go the distance. Backed by customer service that goes that extra mile. Great guys, great products, and a great company that is making optics affordable. On top of quality optics that pay close attention to the customer experience, did you know that scopes come with mounts so you don't have to worry about finding one that fits? We are so excited to have them as an official partner of the show, and ask for them at your local gun store or find them online at blackhoundoptics.com. All right, bringing back Dr. Robert Young from DRGO. Go ahead, Wendy. I'll let you.
I'm
Sure.
here.
Welcome back. So I
Thank
wanted
you.
to start off this segment by talking about anti-gun bias in medicine. So when I was listening to the evidentiary hearing for the assault weapons ban lawsuit before Judge Benitez, there was some really interesting conversation back and forth between one of the doctors on the Attorney General's side and Judge Benitez, who, the state was trying to argue that the assault weapons, quote unquote assault weapons, are the problem. And so Judge Benitez is questioning this doctor about whether or not the doctor can identify what kind of gun a bullet wound came from. Basically trying to show that the assault weapon is not the problem. It's criminals.
Well,
so that's just one example that I have. So do you have any other examples of anti-gun bias in medicine?
Oh, my
I know. I'm sure you
We
haven't.
don't have enough time.
On to that subject, though, it's ridiculous. ARs are the problem. Of course, they're not the problem. Long rifles or of any kind are used in only less than 2% of all shootings, all murder shootings. If you want to label a problem, it's handguns, but they can't touch that now because in Heller, the Supreme Court said properly that no government can ban the ownership of handguns.
Mm-hmm.
So now they're reaching for stuff that's irrelevant. When I present slides, my AR slide starts with a statement: "Do you hate me because I'm black? Is that it?" And that's true because it's just looks. So examples of I've got a lot of examples. I brought several along to share if you're interested.
Go for it.
But these are just examples. As I said, most of the stuff that comes out of the public health literature is biased in some way. I happen to be a reviewer for 3 medical journals now, so I get to see this. Sometimes I get to keep this stuff from being published if they listen to me. A big one in 1993 were by 2 guys named Kellerman and Rivera. This still gets quoted. They, quote, found that keeping a gun in the home was associated with an increased risk of homicide by 2.7 times. So they're saying that if there's a gun in the home, you're 2.7 times more likely to be killed. People still quote that. Some people say you're 44 times as likely to be killed. I don't know where that stuff comes from. Well, this is one of the crappiest studies ever published, and you can see it within the study. And this is true with most things. If you don't even have to know statistics to see this stuff. Anybody with a full high school education and common sense can tell. These guys picked 3 of the most crime-ridden urban areas to do this study in. Number 1, well, there are more murders there, aren't there? And when they talked about homicide, they included all reasons that people are killed, not just guns. I mean, more people are beaten to death than shot to death. That was true then, it's true now. So homicide, by their definition, doesn't track with guns anyway. They made no distinction between legally owned and illegally introduced guns. Mm-hmm. And beyond that, they didn't even know who had guns because they got that information from interviews with family, friends, and neighbors after the events. They never saw the guns. They never saw them in police reports. Just absolutely absurd. In their study, far greater risks. First of all, the 2.7 doesn't stand up at all. It just have to throw it out because of these reasons. Far greater risks that actually made more sense were associated with drug use, renting, domestic violence. Those makes more sense. So that's a perfect example of how awful this research is, but people grab it and hold on to it.
Absolutely.
We know about the ban. This would have public health applications, you know. You're talking about ARs. Well, we all know about the ban on ARs nationally between 94 and 2004. What everybody doesn't know, and clearly Joe Biden doesn't know this, is that both the FBI and the Department of Justice afterwards assessed that it had no significant impact on, quote, gun violence. You know, over 10 years is plenty of time for a ban to show some change in the use of the banned item.
But yet he does say that worked, and he actually makes that a badge of honor.
Well, Joe Biden is mixed up on a lot of things we see.
You think?
I heard the NPR report. The NPR, he had a town hall or something?
Sort of, kind of.
Yeah, I heard that referred to as a 1-hour public service presentation on the symptoms of dementia.
Mm-hmm.
Just to turn it to a medical perspective. Yeah,
Well, you might want to find that video and take a look at it
Yeah.
and make sure you're sitting down.
that's right. Let's see. Well, banning stuff doesn't work anyway, but that's not purely medical. There's in some recent work, well, in the aughts, in the 2000s, these people like this studied changes in Connecticut and Missouri when they either Missouri went from may issue to shall issue, Connecticut went from shall issue to may issue. And they saw, well, sure enough, Connecticut showed a reduction in shooting murders or something, and looking at the same issue in Missouri showed an increase. Okay, well there you have it, right? Mm-hmm. No, in Missouri the increase after moving to shall issue was a lower rate of increase than what had been happening before. That's better.
Yes.
Connecticut, the drop in quote gun violence was a less quick drop than had been going on before when it was shell issue. So in fact, their own work showed exactly the opposite of what they were trying to make it out to be, but they chose to only focus on pieces that in isolation make it look like it supports them.
Right.
It doesn't. In 2019, a couple of interesting things. People in California, a guy named Garen Wintemut and a guy named Dan Webster on the East Coast, published an article on California's long-standing universal background checks. I was surprised and pleased to see this published because they had to come to the conclusion that prohibiting everyone with a violent misdemeanor, which is an idea that's been mooted for the NICS and stuff to expand the number of prohibited persons. California has been doing that for years, and it did not affect any rates of firearm homicides or suicides at all.
Interesting.
So they came up, and this is a reasonably interpreted study. So even these anti-gun researchers sometimes run into a brick wall and have to admit that they see that their preferred ideas don't work. One of our DRGO members, a surgeon, published the same year in Journal of the American College of Surgeons and he looked nationwide at everything, everywhere, every jurisdiction. States liberalizing concealed carry saw no effects, either way, on violent crime. Now, this isn't the main argument to make. The main argument is the rights protected by the Second Amendment. But there's all sorts of data out there showing that we're better off, if at least not worse off, by civilians owning guns and having them just in case. We can talk about defensive uses of guns, too, where I came into it. We know about Kleck's research in the 90s. What a lot of people don't know is that his finding that there are probably 2 million or more defensive uses of firearms each year. Yeah. This work was replicated in a survey by the CDC 2 years later, and it never published its findings. Gary Kleck ran across it 2 years ago.
Very intriguing.
Yes, it is. And they were still run by the same people who said we have to get rid of guns and make them hated by the American population.
Yeah.
They never published it because their findings confirmed Kleck's.
Yeah. Absolutely. So we got to wrap it up, but I want to give you 1 minute to let us know about how we can get involved with Doctors for Responsible Gun Ownership and what listeners should do to take action against anti-gun bias.
Well, follow us. Our website is drgo.us. We're on Facebook at Doctors for Responsible Gun Ownership. We welcome any members. We ask for $40 as a lifetime membership fee, but if you can't afford it, join anyway. People are welcome to get involved to help us in a number of ways. We'll tell you how. We have a big project that's been going on for years. We're trying to match gun-respecting healthcare providers with patients who want that sort of provider. Too many patients are bullied by their doctors.
Very
Wow.
cool.
That's the best thing you could have ended the segment with.
Yeah.
If there ever was one.
Okay.
Well, thank you very much, Dr. Robert Young. That was an amazing 2 segments, and we look forward to talking to you down the road.
I'd be delighted. You all take care, please.
Thank you, sir.
Thanks for watching this clip from Gun Owners Radio. You can watch us live every Sunday from 4 to 6 p.m. California time, right here on our YouTube channel, or if you're in the San Diego area, you can listen to us on 1170 a.m. We're also available on your favorite podcast platform for free. Don't forget to like and subscribe so that you can help restore and protect the Second Amendment, not just in California, but across the country.